All right, broadcasting. So we should be getting folks coming in a few. Yep. So we'll, oh, yep, here they come streaming in. Hello, everyone. Welcome. We'll give everybody a few seconds to pop on in.
We can't see who they are.
If you scroll over to attendees, you should be able to, or maybe only I can see it.
Oh.
Yeah, we just see participant number.
All right.
I feel like I'm in an aquarium or something.
Everybody's watching you.
If you click on participants, it'll open up a window. There'll be two tabs. One says panelists and one says attendee.
Oh,
yes.
Fantastic.
Wonderful. Well, welcome to everyone to this first this first experiment in our Zoom events. Welcome, everyone. I'm Lee Pfeffer. I use they, them pronouns, and I'm the Museum Operations Manager at the GLBT Historical Society. And so I'll just be starting this off with a little bit of housekeeping. If you've never done a webinar through Zoom, we're going to be going through and talking for about 45 minutes with all of our wonderful panelists and our moderator, Executive Director, Terry Beswick. And after we are through with kind of our conversation, we're going to open it up to everyone who's watching to be able to participate in a question and answer section. If you've never done a webinar on Zoom before, it's really easy to participate. Right now, everyone has their microphones muted, but we can unmute you if you have a question. You should see on the bottom of your screen as an attendee, you should see the ability to chat, Q&A, and raise your hand. So if you would like to ask a question verbally and you would like for us to unmute you and you can give your question directly to the panelists, you can raise your hand and click that little button and I will be able to see that and then let you know that you'll be next to talk. And if you accidentally hit that, you can easily hit lower my hand. If you don't feel comfortable doing a question verbally, you can also feel free to send a question in using the question and answer function. You can send that in via text at any time, so don't feel like you have to try to keep a question in your brain. If it comes up while folks are talking, you can send it and we'll have it ready to go for when we are ready to answer questions. So let me pull something up really quick. Our wonderful executive director, Terry Beswick, is going to start us off and kind of introduce this wonderful group of folks that we have to speak to you tonight. Unmute yourself, Terry.
Sorry about that. Yeah, and if my dog starts barking, I apologize. I am delighted to be here with all of you tonight. I've been executive director of the GLBT Historical Society just over 4 years now. And shortly after I started there, we had an election shortly before, actually, and then an inauguration, of course. And we started this series on a monthly basis to look at contemporary social issues in a historical context. And we were doing monthly forums at our physical museum in the Castro, very well attended. One of the forums that we had was actually convening, actually several of them, I think, were convening activists from the heyday of the AIDS activist era in San Francisco, and talking about how we can sort of corral that energy and apply it towards the resistance, as it were, to Donald Trump. And so now we're in the midst of the COVID epidemic, and it's all hit us like a ton of bricks. We've moved everything online with the Historical Society as quickly as possible, and we're continuing to do that as is everyone else who is able. And we really thought, for myself personally, I'm involved in the community and doing what I can to help to combat the COVID epidemic, and as are all of you. And we thought it would be really important to bring people together to talk about the lessons that we had learned from AIDS, not only in the activist realm, but in all areas of our culture and our society, that and the lessons that could be applied to the epidemic as we see now. Sometimes I find myself just watching the news and I'm so frustrated, and I get a lot of echoes from the past. And I feel like, oh my God, didn't we learn this? Or yeah, anyway, so I'm getting to that age, I suppose, where I start throwing my shoe at the TV. Um, so for this first one, we wanted to bring together some of our local comrades from the ACT UP days, and there were a few iterations of ACT UP in San Francisco, and a few precursor organizations to ACT UP San Francisco that were involved in direct action to try to affect change on the government level, locally and in the state and federally. So we didn't want to like focus on one particular chapter or iteration of all of that, but just to look at what's commonly been known, at least in the media, to be that ACT UP type of era. And so we've brought together several esteemed panelists here to help us to sort of broach this very complex and difficult topic. We only have an hour. So what we're going to do, I'm going to introduce the individual panelists just very briefly, and we're going to post in the chat panel there everyone's bios, and you can also look those up on Facebook. So I'm not going to get into those in any great depth. And then I'm going to ask each panelist to just speak for 2 or 3 minutes about the topic, basically, of what lessons from the AIDS era can we take to apply towards the COVID epidemic with respect to direct action in affecting government policy. So, let's see. To begin with, I just want to introduce my friend Brenda Ling. Brenda's coming to us from over there in San Rafael, California, clear across the bay. And Brenda was involved in Project Inform when I was with the organization. She was also with ACT UP Golden Gate and very active in working on treatment and research issues there. She became director of the Project Immune Restoration with Project Inform, and was really highly regarded across the country as being a leading activist in creating an effective policy, especially around clinical research and access to therapies with respect to AIDS. So thank you very much, and let's give a hand to Brenda. Gerard Koskovich is another good friend. He was actually a frequent legal observer of our actions with ACT UP San Francisco. When we would get involved in civil disobedience and get arrested, it was very important to have somebody there who was a dispassionate observer who looked somewhat credible to the authorities, so that we could, get bailed out or what have you. And so Gerard very much filled that role. He hasn't changed a bit. Today, he is a leading historian around queer history, known internationally. And was a founding member of the GLBT Historical Society, also a rare book dealer. I rely on him very much for advice in my work, as I am not a historian. Lido Sandoval is part of the group of people that it's known as my boss. He is on the board of directors of the GLBT Historical Society and has been involved in AIDS activism for many years, as well as queer arts activism and what have you. He's a writer. He was a member of ACT UP San Francisco, which is when I got to know him in sort of as I was leaving and you were coming in, I believe.
Yep.
And I think prior to the split, because once the split happened, I was gone. Anyway, Matt Sharp, he was also very active in really in a leadership role with ACT UP Golden Gate and involved with national work on treatment advocacy also in the late 80s, early 90s. Matt moved to Chicago in 2000 and was involved in the Positive Action Network there. Let's see, and also has worked with the Asian and Pacific Islander Wellness Center doing a treatment education, and many other things. Positive Aware, Test Positive Aware Network in Chicago. Sorry, I got that wrong. With that, I want to, let's see, who wants to go first? Brenda?
Oh, sorry. I'm learning the technology as we go. Sure, I'll go first. I think from observing what's been happening since January, I've been following the COVID epidemic first in China, and then as it's rolled its way throughout the world. I think that there are more differences in COVID than similarities in AIDS activism, maybe with the exception that the research establishment is the same players. So we know the same people. All of these faces are really familiar. We've all worked with Tony Fauci, Bob Redfield as well. Debbie Birx is not a new person for us to see on the stage. There are new players as well, but I think there's a sense of familiarity with the research establishment. The rest of the government structure is not the same as the early days of AIDS, and it's hard to say if it's better or worse. You know, we haven't had to wait years and years and years for Trump to say COVID. But it took, you know, maybe the equivalent in lives, I'm not sure, possibly, for him to acknowledge it. And I think we've never had a government be so sort of participatory in the spreading of bad information. As a Project Inform employee, I used to have to deal with a lot of fake cures, and I'm kind of amazed at how much misinformation, medical misinformation, is coming from the government. So with that said, I would say that some of the lessons learned and what we can utilize are our ability to be thoughtful researchers, to be willing to take the time to understand complex information, to develop relationships with government researchers, industry, and pull players together as needed to move forward to positive change. In those ways, I think we can, you know, use the skills that we have developed to make a difference. I want to take up all the time, so I'll leave it there and talk more later. Terry, you're muted still.
Nobody heard me cursing there, thankfully.
We're all learning.
Matt, can we hear from you next?
Sure. Just jotting down a few notes while we're going here. Thanks, Brenda. Thanks, everybody, for inviting me today. This is a very unique time. I had somebody was posting a message that's saying we shouldn't compare the AIDS epidemic to the COVID epidemic. And I thought, well, why not? I mean, we've got so much to compare and so much to learn and you know, bring to the forefront in what we learned and what we didn't learn. I'm just going to say really from the start, I think you all know the main difference is the technology and some of the tactics we took back in the day, in the old days, may not be able to be employed today. The number one thing is direct action and demonstrations. We can't gather in groups, right? So that ain't gonna work. But there's a lot of other ways I think we can employ those type of tactics in that kind of direct meaning, in that way, that don't require us to be in a group. In public. So I think people are smart enough to come together to figure that out. We just need to come together to do that. And one more thing I just want to say is I worry about the psychosocial component of where we are today with people living with HIV that have survived the epidemic, but also all of us who may be alone for whatever reason, all the implications of being gathered together in a family, whether perhaps you're a gay youth person who's not come out yet and you're stuck with a family who's not open about discussing those issues, and maybe violent, or maybe you're with a partner who you're stuck with in that kind of situation. So all of those things I think we need to consider in conjunction with what we can do as activists to change where we're at this point in time with the epidemic. So. That's all.
Thank you, Matt. Next up, we're going to go with Lito. Can we hear from you, please?
Sure. Yeah, I mean, like Brenda, I just sort of, I don't see as many similarities per se. I mean, it's also at this point in time in life, things are just so screwy. I think in the time of AIDS, we had a government that didn't respond because of who AIDS affected. Now we have a government that just is, let's be honest, fucking incompetent on every level. I mean, and spreads misinformation knowingly for his own ego. We know which players, like Brenda mentioned, the players that we know in research that we have a working relationship and can trust. Also, Matt definitely mentioned one of the things is we can't take direct action right now, which is then we have to figure out something new in the digital age beyond a Zoom conference. There's also, I think, information's more easily spread these days because of the internet, but subsequently misinformation is being spread readily. And I think that I think we learned a lot through ACT UP in terms of how to deal with the medical establishment and how to get information out, correct information out. And I'm, yeah, it's just one of the many things that I've been thinking about over the past few weeks as I've found time to myself.
Great, thanks, Lito. A lot of good stuff coming up that we're going to circle around back to. So in our discussion, before we go to questions and comments from the audience. So Gerard?
All right, thank you. Delighted to be here. And what I'd like to say to start with is just that I'm here sort of wearing two hats. One, my hat as a historian, and the other, of course, my hat as an activist and someone who experienced the era of HIV/AIDS and HIV/AIDS activism. And I like to think that those experiences can inform one another and can usefully reinforce one another if I play them correctly and if people help me do so. So what I'd like to do initially is stress that we can regard our memories that we're sharing here and the knowledge, the lessons that we bring from them as one source of historical evidence or data, but as a source that we can look at with the same critical distance we take on other kinds of historical evidence. So we might think that we don't have an intrinsically superior understanding because we are survivors of the AIDS activist era, but that we do bring distinctive and original and useful information to the debate, and that we can add it with our own critical and self-critical awareness. And I think I'd also like to sort of throw out, before we start the panel, some very broad historical questions. So it was great because Brenda took us right into some real nuts and bolts right away. And the way I'd like to go all the way out to the other end of the telescope and instead say that it might be helpful if we also think a little bit about what we mean by political responses and how we might think of shifts in affect, shared feeling as themselves constituting a form of politics, a kind of political response, the move from fear to grief to anger to collective action, that's something we saw in the AIDS crisis. And I think it's something we might be seeing currently as well. So we can learn from that broader experience that we had. And also ask ourselves some questions about what are the little things that we're doing individually and collectively in daily life that in fact are forms of politics or the basis of politics, thinking of that great feminist formulation from the 1970s that the personal is the political. That's where our politics start. And all of us, even in sheltering at home, in self-isolation, have the possibility of the politics of everyday practice at our fingertips if we think about it with critical eye and with awareness. Similarly, what qualifies as direct action, and I think back to the AIDS era and some of the kinds of tactics that we developed there before we were out engaging in protests, and particularly the tactics of self-empowerment, deciding that identifying and cherishing our intimate friendships and our chosen families, something that cisgender and normative people don't really think about and don't have to do, that was one of our first political steps. That thing was something that we had that we could bring to this fight. Similarly, the discussions that we had with one another privately and publicly that pushed all of us to think more critically and self-critically goes towards some of that things about misinformation. We learned from each other how to separate nonsense from critical thinking and how to separate idiots from credible sources, and that those remain crucial skills today, right now, as some of the introductory discussion has already told us. And finally, of course, put a historian hat and my founding member of the Historical Society hat back on. The Historical Society was founded in 1985 in part because the AIDS crisis left us terrified that not only would society have erased our history as queer people, it would then erase the history of the genocide it was carrying out against us. We seized the idea that we were actors in history and that we could record our own history as a way of empowering ourselves in the face of this terror that we enact against us and uncertainty that surrounded us. Again, that's what heterosexual and cisgender people don't have to do. They're born owning a place in time, having a sense of belonging in history. Queer and trans folk don't have that. And I think once again, within our communities to empower ourselves, that seizing that sense of belonging in time and belonging in history will be super empowering. And the nuts and bolts call there to everybody taking part today is start recording the history that you are living through right now. And honor your own experiences, whatever they are. Leave a record so that it will be remembered and provide lessons for the future.
Great. Tikish. Thank you, Gerard. Okay, back. So, gosh, there's a lot there. Where to begin? We have such a brief amount of time, and I just want to say, first of all, for those who are joining us later in the discussion now, that the panel is being recorded and will be posted on our website. And we will come back and do another one of these. It could be in early May, specifically looking at these questions of direct action and affecting government change. Next week, we're going to be looking at art and artists from the AIDS era, their responses to AIDS, or the generation of art during the AIDS era, and similarly, how art might be created and inspired or motivated by the COVID epidemic. And so, circle back, let's see, so much. I'm thinking about, first of all, just a practical thing. Let's dig a little bit deeper into how we did our work during the ACT UP days. And Gerard, you touched on this, that there was the motivating stories of people that we knew or ourselves, our own lives, and the specifics around that. There was a person with a specific disease who needed a specific treatment and needed help getting that treatment. And so oftentimes there would be, or if it was a social issue, that somebody was, a legislator was threatening to quarantine people or to execute mandatory testing. And that caused fear within us. And so we would bring it to a meeting, outrage would ensue initially, and then we would go back into our study groups and try to figure out what's the facts, collect the data and the facts, what's going on here, and then come back and figure out what's a target, what's the appropriate target, what do we want to have happen specifically, and who is in control of that, who's the decider, and then how can we get that decider to change their mind or change the policy to do something different. And so that was kind of the process then. How does that work now? You know, I mean, we used to go to a physical meeting, of course, and there would be somebody who would stand on a chair and say, you know, they're shooting a film that's making people look like they're purposely spreading AIDS amongst straight people, gay guys spreading, you know, and then we would go and shut it down. So how do we do that now? What do you see happening?
So
Okay.
Brenda, you are on mute.
Okay, I was like, how do you want us to do this? So I think that one of the issues that makes this really different is we used to have a friend having an issue, we would see it, we would all rally together and discuss, like Terry said, but in this context, we don't have the luxury of time for that. This thing is moving so fast that there is not, let's get a meeting together, even barely on Zoom or on the internet. I mean, if you're going to try and do something, you've got to do it now, because in a week that person may be dead. This thing moves fast and it's a completely different context. So ramp that up on steroids and you stay up late at night, you figure out what you're going to try and you try and do it. But another thing that's different, and this is important, is that, and this has got me reeling as an activist, is the willingness of the powers that be to move is like nothing I've ever seen before. When it comes to research and treatment, clearly when it comes to homelessness, Terry, that's not true. I mean, I see what you post on Facebook and there's nobody getting those people homes. But when it comes to research, I have seen the research community do what they have told me for years as an AIDS activist was completely impossible. They are collaborating. They are moving biomedical research in ways like things that should take 3 years have taken 2 weeks. And there's lists of drugs going into clinical trials. And it's amazing. And it's almost like step back and get out of their way. So I think that we've got to be really thoughtful about where we put our effort, because in some ways we could just get in the way of an amazing amount of progress. But I think some of these larger social issues like homelessness and how it's contributing not only to the epidemic, but how people who are living on the streets are going to be suffering, and who cares about them spreading disease? Look what's happening to them. There's less of a will to deal with that issue.
Yeah, Matt, I see you nodding your head. Do you have something?
yeah, I do that a lot. Bobblehead. No, but one of the things I want to say that's different today about coming together in this aspect, not only is the time to make decisions really critical and to come together really critical, but how do we come together as a consensus to agree upon something? It was already hard back in the day, so how do we do that today? I'm not sure. I think it's almost like we take a targeted, someone takes the bull by the horns and takes the issue and goes for it, and gets a group of people on social media or whatever to do what they need to do and just go for it and do it. And then, you know, sometimes you're going to have failures with that and sometimes you're going to be successes, but there's no time to bring everybody together as a big group, right, Brenda? So it's like we really need to figure out a way to just do spot actions or whatever there is needed at that time to change something. We're not going to be able to do it in the same way.
Right. And we have, you know, obviously, and we've talked about this, but we have a different set of tools available to us, and some of them are much more useful in terms of facilitating our collection of knowledge and disseminating it out quickly. And so, in a certain sense, you can put together a little zap, if you will. It's just going to be a little bit of Facebook shaming or you know, a Twitter attack, and you know, and there's phone calls and letters too, and I think that those things are important, but it feels a little frustrating that we can't just go, you know, and have a little old-fashioned sit-in, you know, and say, and you know, and wait it out. But Lito, did you have anything to
No, I
add
was
here?
just gonna say, I mean, that's certainly one thing in terms of organizing, is going back to, you know, the phone, you know, actually making phone calls, You know, we have emails. It's just also just thinking about, yeah, in addition, what's going on now, aside from the sit in place orders that we have, is how many people have actually are out of work. Didn't realize what hit mute there. I'm concerned about, you know, people that are out of work right now. Definitely back in, you know, back in the day, hate using that, but what I'm about to get to is, you know, the way we sort of oversaw the before intersectionality was used as a word, or a concept, is how we actually looked at a lot of different things, you know, whether it's race, class, you know, fighting for the rights of sex workers, um, and a lot of, currently now is getting back to, you know, people out of work, is a lot of the inequity that's happening right now in terms of access to health, not just access to healthcare, but even access to a social support. I mean, you know, I have friends that are sex workers, and you know, they're essentially, you know, they're they're not going to get you know, any type of grant or government bailout. So I think that this is a good time to look at, eh, you know, we fought for social justice, not just um, access to healthcare and that. You know, we fought for social justice, and I think this is also another time to be looking at that. People are now seeing, you know, this is your life without a job, and yet you got rent. You know, there's so-called you know, eviction protections, but they're not like rent cessation. You know, at the end of the 3 months when this is up, you are going to owe 3 months of rent. Uh,
Mm.
so I'm concerned not just about like the treatment aspect, but just the whole overall social aspect. What's
Right.
going to happen, especially in a city like this, which is just so expensive.
Yeah, I think this goes back to identifying what the issues are. I mean, and one of the aspects of ACT UP that was interesting was that we really came from a lot of different parts of the mostly queer community, and we had our different priorities. And to the extent possible, you know, if for example, I saw Carol Lee was part of the group, and you know, prior to being an ACT UP, I didn't care or even think about, you know, prostitutes, workers' rights, or or you know, prisoners' rights, which is we also worked on, especially around mandatory testing and that kind of thing. But she came to our protests on, you know, access to DDI or whatever, and then we would go to the protests around prostitutes' rights. And I think that that's an important part of the direct action coalition work that we did. But I want to also mention that one thing that we did well, uh, well, we questioned the authority. Obviously, that was a big part of who we were. Um, uh, and we asked the tough questions, and we didn't assume that because somebody had a degree or they were a high-level politician that they knew better than we did. That we really asked. And I was in a conversation a couple of days ago with a local elected official, and I was talking about the policies of the public health department with regards to people that are homeless on the street. And he was saying, well, you know, this is coming from Grant Colfax, who's the director of the public health department, and from the CDC. And I wouldn't presume to substitute my judgment over theirs, nor would I presume to substitute your judgment over theirs or around what should be done. And of course, my ACT UP blood was boiling to say, actually, no, it is my right to ask and to question whether the CDC is issuing the correct policy on how to deal with this. And that's not good enough just to say because. So, Gerard.
I think I'll jump in and follow up a little bit on some of that. And one is that part of what we've been saying is that one thing that's very similar between this epidemic and the AIDS epidemic, and perhaps most epidemics, is that it's giving us an X-ray of the profound inequalities and disconnections in our society and the profound injustices that are executed on a daily basis and called normality, called democracy, called our government. So I think we're being called to recommit ourselves, as we did during the ACT UP era, to not letting those marginalized people, those people most forgotten, be remarginalized. The other thing is for me to sort of go back again to the initial starting point, which is, and we're still feeling this very much, although I'm not talking about it as much, but we felt it very much at the beginning of the AIDS crisis, and that was profound uncertainty and deep fear and anxiety for ourselves, for our loved ones, for whether we would survive, for whether we could earn a living. That same atmosphere is still present for many people today. I think that we have the advantage, perhaps, that those of us who are survivors of one wretched epidemic already, where we nursed our beloved friends to their death at the age of 20 or 25 or 30, that we've learned to be a little more able to be present with that fear and uncertainty, not to deny it, but also not to be disempowered by it. And so I think we can help give a model and give encouragement to our peers who weren't paying attention during that previous epidemic, and to those who were not yet alive, that it is possible to be afraid and uncertain and effective, to continue to act, continue to think critically. Denial of that fear doesn't help, but being paralyzed by it doesn't either. And we can find ways to support one another and be frightened and also take action and think critically. So that's a lesson from that last epidemic, I think, that is useful for today.
Anyone else want to chime in here? Okay.
We do have a few questions that have popped up when we want to move on with those. I know that we've been sort of addressing some of the questions that have been coming in, but we do have some things.
Thanks. Yeah, I see one from Paul Aguilar, and I'm just going to summarize it here. Basically, you know, Paul was involved this week in AIDS Watch 2020, and it was online. They signed a lot of petitions, you know, organizing to, he's also a member of the HIV Advocacy Network. His concern is that all the virtual work that he's done this week, he doesn't see or feel as though it's had any impact. And it feels counterintuitive to the kind of work that we did 40 years ago. And so his first question is, how do we know that our digital actions are having any effect? Brenda?
Unmuted. Well, you know, one of the things that I've noticed just locally as I've been focusing a lot in the county that I live in is that as I've been sending emails to my elected officials and county health department, one of the ways that I'm seeing that it's making an impact that I'm doing that is literally within days of sending something, I see them responding to that issue in the press, to me directly by emails coming back. I see policy changes. So I think one way that we can assume is if the policies are changing in the direction that we're advocating, we're making an impact. If they're not, then we're not. And that's the most obvious way you can, I suppose.
Yeah, I think that's very important. It's about the results. I mean, sometimes I feel a little bit of satisfaction just to get a response, you know, to a message or a phone call or something like that. But there's always a little bit of couching. Well, I don't really have any control over this, and we've asked, and we've screamed, and we've yelled, and the mayor's not doing this or whatever. And the bottom line is, when I read it in the paper, you know, that the mayor has done this thing, then, or at least, you know, I mean, because I could be wrong. I mean, we're still in the data collection phase too. We don't, you know, sometimes I'm not sure if the mayor is doing a good job. Honestly, I really don't know. But I have questions, and so that's, you know, yeah. But it's about the results. Bottom line. Let's see. Valerie Rojas asks. She's, first of all, she says she loves this conversation. Thank you, Valerie. We love it too. You believe that there is a disproportionate amount of marginalized individuals being affected by COVID-19 and not much is being done to protect them, in the same way that there was not a lot being done to protect affected communities in the combating the spread of AIDS. Brenda, unmute.
I am a big mouth. Well, just look at what's happening in Detroit. I mean, looking at the epidemic across the country, Michigan is having an explosion in Detroit uniquely among African Americans who, and there's a lot of discussion there about why this is happening, and it's happening because of distrust of the medical establishment based on years of neglect and disenfranchisement. So yes, I think we will see people who have been historically disenfranchised here. But, you know, I also kind of bring in and remember that those most at risk for death overall are elderly and people with these underlying conditions. And if you look at inner cities and you look at rates of asthma among children of minorities who are living in inner cities, you'll see, well, of course, they're going to be disproportionately infected because of the comorbidities that you see among the communities that you're referring to. So certainly there'll be disproportionate people affected in the traditional groups we've always seen, and across the board, the elderly, regardless of what other contours you see about the community.
Matt, did you have something?
I just want, I want to go back to sort of a nuts and bolts thing about, you know, determining whether the things you're doing are working or the things the community doing are working. And that is to create some sort of feedback loop or feedback mechanism amongst what actions you're doing towards that representative. Make sure that once you speak to them, that you make sure that they're one of the points that you want to make to them is that you hear back from them. I mean, that's a basic kind of rule of lobbying or kind of action of lobbying. But in this aspect where we're moving very quickly, it's even more crucial to get that sort of feedback from people that you're lobbying, and make sure that you get an answer and response from them as soon as possible.
Right. Yeah. And to go back to Valeria's question also, and I agreed with what Brenda had to say to that. And I have been working a little bit on just in my immediate neighborhood here because I walk my dog and I see so many homeless people. And so I have been posting photographs and advocating with the local officials here to try to do something. But I'm at this point dismayed, as are many members of the Board of Supervisors and of course housing advocates, that basically the decision that has been made is, you know, to try, there's hotel rooms that have been dedicated to move people out of shelters, SROs, healthcare workers, people that are positive, that need to be segregated but not hospitalized. And there's room being made for additional shelters for people that are currently in shelters, but they've really written off in a policy decision anybody that's still on the street. They're going to try to move people into hotels and shelters that are over the age of 60 or have complicating health problems, but not everybody. And so, you know, we have thousands of people that are still on the street, and it's not acceptable to me. They're clustering together in tent groups, and of course they're living in completely unsanitary conditions. And this didn't begin with COVID, of course, but it is very much in our face right now, and it needs to be acted on today. Gerard, I'm just gonna, okay, go ahead, unmute.
Thank you. So I'd just like to jump in on a couple of these themes, and one is to go back to the question of how can we tell if we're having an effect? And again, calling up our experience from the AIDS activist years and thinking of early on and the bigger picture of those years. The first measure is, have you asserted your own dignity? Have you refused to be complicit in a system that would make people forget the marginalized and the most outcast in our society? So that first step of, are you having an effect, is, do you have an effect on yourself by taking action? And give yourself some credit for that. That's the first step to being able to continue taking all the needed steps. The second one is that perseverance is crucial. We have increasingly learned in the last 25 years to think that everything takes 30 seconds, that if it doesn't take 30 seconds, we can change the channel. And of course, it is urgent now that we get action, but it's also urgent that we persevere and that we not become disheartened if we don't get immediate results. And another thing we learned particularly with regard to this question of the most vulnerable, is that working in coalition is crucial to our success, and that finding the representatives of these different populations and finding ways to work together was a key to much of what ACT UP accomplished. And recognizing that even as we felt that we were being excluded from society, that our demands for change and for effective action were about saving ourselves and everybody else too, that we were contributing to the well-being even of the people who didn't care about us. And
Right.
I think that those are some kinds of wisdom from our actions in that era that might help inspire us to stick with it today and continue doing the work necessary.
Yeah, and I think that that was really important. A lot of talk back then was about how, you know, we as activists were only concerned about saving our own lives. And I think that that is such a false characterization of the activists I knew, certainly some of that are on the panel tonight, but the ones who passed as well, that they may have been fighting for a specific drug for themselves, but they were really a guinea pig that was very brave and volunteering their body often to try a drug for the first time so that it could be made available to other people, even though they may not survive themselves. And there are many examples of that. I want to just jump to a question that I've just lost from Laura. Where did Laura's question go? Oh, it went into answer. Did we answer Laura? No, we didn't. Mostly for Brenda and Matt. I was stunned at the FDA's action. This is Laura Thomas. I was stunned at the FDA's action this week to approve hydroxychloroquine for treatment of COVID-19. I never imagined the FDA could move this fast. What do you make of this sudden move, and what would happen? What had to happen? Brenda?
Okay, Matt, do you want to answer that?
Okay.
We can both answer and just leave our mics open. I mean, I don't know what you think, but I think things have changed with the FDA significantly, and they're able to, you know, they've always been able to take a drug at the moment and move it to a fast track. In other words, in cases where there's emergencies. I think this is even a more special circumstance where they were able to look at the data and be able to come to that decision quickly because of this particular drug. I don't know. What do you have to add?
I actually don't think it was FDA approved. I think that there's a nuance in here, and that the FDA reviewed this and sort of gave it a larger okay for off-label use, which is if you have an approved drug and you're using it for an indication that it's not approved, you don't typically really have to go to the FDA necessarily, but when you have thousands of people asking for it at the same time, they're saying, okay, you can use it off label until the data comes in, which is different from receiving an indication for use the saying it's okay, well, current clinical trials are ongoing, but it is not approved in any fast-tracked way for the treatment of COVID because we don't actually know if it works, and there's no data at this point showing us that it's prolonging life. And the interesting thing is, if you look at the disease process, and there's a lot we don't know about it, and it's so crazy to me, like if we said, tell me the stages of AIDS. What's ARC AIDS-related complex? What's, say, less than 200 certain indicator infections? In the case of COVID, tell me this: what does mild disease mean? What's severe? What's moderate? What's serious? And at this point in time, even as someone who's been on top of the literature like crazy, I don't know the difference between those stages, and they may not be consistent across the board. And where hydroxychloroquine fits in may be a unique place in the disease process, and things may be useful for early disease, the first couple weeks, that are not really suitable for advanced disease, which is much more of a pulmonary thing. So to be careful, drugs, it's not FDA approved. We don't know if it works. It probably isn't going to pull someone back from ARDS, which is the respiratory condition that people are dying from when it really gets advanced.
Can I say one more really quick thing, and that is to just really, really be careful with all the information that you receive or that you see, because there's so much going out there. We know this by now, but don't jump to any decisions or conclusions just because just right now we had a difference in that answer, and that was just because we had different input going into that. So you just have to be careful with everything you hear.
Right. Yeah. And again, I think it's just important to ask critical questions. In a sense, I think AIDS activists were kind of like journalists. I mean, we had to really think critically and ask tough questions and try to look at all sides of an issue before we would come up with an answer. And I think at the same time that we can't get too bogged down in all the reasons why something can't be done. That ultimately you have to look at what are the results that you want. And, you know, there's a tendency to get enmeshed in the bureaucracy of it and sort of, well, you can't do this because you got to do that. And then this committee's got to approve it and that committee's got to approve it. So it's kind of like assuring actually that, and I think that AIDS activists did sort of chart a path that allowed this hydrochloroquine to be introduced so quickly now. Although, you know, it has a safety profile that's understood, and so that's, you know, so that's different as well. But my big concern is that there's politics involved, and that the president stuck his neck out and spoke in favor of this based on very limited information, and hopefully it will be confirmed to be true. But you know, whether the, as Brenda was suggesting, whether the clinical guidelines are going to suggest its use now with COVID in a very advanced or even end stage disease where it doesn't have a chance of working, or whether it would be most appropriate. And we just won't know until the more confirmatory clinical trials are done, larger clinical trials. We're talking about numbers of 2 or 3 people right now. It doesn't really mean anything. So we could really get deeper into that, but I just want to go to another couple of questions. Liz Heileman, hi Liz. Liz should be on this panel. Liz asks, do you see lessons from AIDS activism about things that we shouldn't repeat or that probably won't work for COVID? Brenda kind of hinted at this regarding not getting in researchers' way. Lito, do you have any thoughts on this? What lessons from AIDS activism that we shouldn't repeat or that probably wouldn't work with COVID?
Probably not have a split. You know, it's just sort of looking back on things. Yeah, it's just a hard one for me to answer. I think you know, as I've said, as we all said earlier, you know, the inability to actually get together and work things out, or even that communal factor. I mean, Zoom has its limitations. It's there, but it has its limitations. I think that those of us who are around back then, I think probably one of the bigger lessons is to not be know-it-alls, because I'm not. I'll be the first to tell you that. You know, and to also be open to newer ideas. It's like, you know, insert yourself into the conversation, but don't insert yourself as the master of the topic. Yeah, I think that that's certainly something. I mean, let's be honest. In the early days of when PrEP became available, you had so-called you know, name AIDS activists from New York who were against PrEP. So, you know, AIDS activists that are highly regarded don't always have the right answer.
Yeah, that's
I don't know
good.
if I answered that. That
Actually,
was
I
more
was thinking
commentary,
about this.
wasn't it?
And Brenda, I've really enjoyed your epidemiological tracking since day one when we first heard about this in Wuhan. And yet today I'm like amazed at how many expert epidemiologists there are suddenly out there in the world, that are telling us, you know, what the forecast is and all that. So it's a little, but that's the way we were too. I mean, it takes a certain amount of hubris to sort of like talk on the level of researchers and ask those kinds of hard-hitting questions. So, you know, maybe humility in some measured doses. Let's see, a question about recovery from Michael Epstein. There are so many incredible stories of how the community supported patients and survivors in the hospital and all around San Francisco. What can we learn from this story of support as we move towards an era of recovery?
Can I chime in?
Yeah, that'd be great.
Buddy programs, and one-on-one support. If you see somebody out there that's in need or lonely or alone or whatever, find out who these people are, grab onto them and follow them. Especially if they're older or they need some kind of support in that way. I mean, the buddy programs were a great model. We were in the beginning and they are today still. So how can we create that in this new era, this new technology? How can we create that?
All right, and there's a lot more that we could say about that. It's still unfolding, but I think
Can I jump in for 1 second, Terry?
Yeah, go ahead.
One thing I'd like to add is that since we're doing this as the GLBT Historical Society, I'd also like to pull off one of my ancient hats, which was for 10 years, I was a journalist in the field of aging. And I'd like to remind people that particularly in the LGBT community, there's a much higher percentage of older adults who live by themselves and who report having no direct personal contacts who they feel that they can call on to assist them if they have problems with activities of daily living. That particularly as LGBTQ people, we need to be sensitive to the elders in our community to find ways to reach them, to talk to the local organizations that support them, and to make sure that we constitute the family they don't have, or they will be severely affected by this pandemic in ways that will be even more marked than will be the case for elders in general.
Right, that's a really great point. I'm gonna like.
That's a great point, Gerard. I mean, I think definitely.
Lito, I'm sorry,
Okay.
we only have a few minutes left, and I gotta go and do a final round. I'm really sorry.
No worries.
And I want to just say that two questions. I'm gonna go around the room once more, and you can just say whatever you want, Lito. You don't have to answer the question. But the question is from Gwen Katz. In an event that unfolds this quickly, how do we decide when to compromise and accept a less than perfect solution and when to hold out for something better? Great question. And the second thing, if you guys could just go around the room and answer that question and then add in just briefly, what is something that people can do today to get involved in the fight against COVID-19? So how do we decide when to compromise and accept a less than perfect solution and when to hold out for something better? I'm going to start with Matt.
Well, I think I kind of brought that up earlier about how we make decisions and how it's so much more complicated today, and especially with this short time frame and making so many complicated decisions, it's really hard to think about even compromise or how far you want to go to the right or left. So it's hard. It's a hard one. I don't have a good answer. Maybe someone else does. I wanted to say in closing, and for me, that I really worry about how this is going to all unfold as people get better and how we start moving back into society. What's that going to be like? What's the mental health? What has happened to the mental health in this population, in society, and in people with HIV, particularly, and LGBT folks who are going back after this 3 months, 6 months, 5 months of this disaster.
Yep, thanks, Matt. Let's see, Lito. Now that I cut you off, I'm gonna turn it back over to you.
I mean, it's, for me, it's all very different. I think in all honesty, back in the day, there was a way to transmit HIV, and we could do what we could to not spread. Right now, we're dealing with something where just everyday being is, you are potentially in danger, even if you wear a mask. You may not wear it right. You may not take your gloves off right. You may touch something that someone who doesn't know they're infected, or and I think that sort of uncertainty certainty to me is scary because I'm, 30 years older than when I was in ACT UP. I also have, pre-existing health conditions. And I'll be honest, I have not left my house. I am Howard Hughes here. So, and I worry for friends who, I worry for the people who work in the grocery stores. I worry for my sister who works in a convalescent hospital. I worry for a friend who's a nurse, in a prison. So there's that. But I'm not in a pit of despair. I mean, I'm on here and I talk with people, right? And I think that that's certainly one of the things within my network is that we talk to people, and that my network is intergenerational and multi-gendered and multinational, and it's a big network. And I think that sort of Matt got to that point of being in communication. Gerard talked about reaching out to people and elders who don't worry about who to reach out to. And I'm glad that I have friends who are actively reaching out to people to check in. Hey, how are you doing? Do you need anything? And I think that that level of just social support is great. But again, I'm also, aside from the nurses and people out there, I'm worried for friends who've lost their jobs, worried for sex workers, that I know many. So it's still trying to figure out how do we deal with this myself.
Yeah.
So.
Well, I think it goes back to something Gerard was saying, which is the personal is political. And with that, I'll pass it off to Gerard for a final comment.
Excellent. First, hello to Gwen Katz. That's one of my nieces in the Los Angeles area, a young adult novelist. And to address her question about when to compromise and when to hold out, I think, again, I tend personally as a historian to always go back to first principles, which is one thing we often ran up against difficulties with during the era of high AIDS activism and that faces us again today is thinking clearly about what is a tactic, what is a strategy, and what is a goal, and not confusing those things. Clarifying our goals first, holding to those, but not being rigid about strategies and certainly not being rigid and moralizing about tactics. So that basic analysis of where do we stand, how can we proceed, I find those empowering ways of thinking and talking help at least find places where we should be perfectly willing to compromise around things like tactics, whereas goals are another whole matter. And then the other thing, particularly hearing Lito talk a bit about the fear and the anxiety that he's feeling, again, to go back to that reminder that we can be afraid and be courageous at the same time and take action. And also to go back to one of my opening themes about being actors in history, that for me, something that was very empowering, almost philosophically, during the AIDS crisis, worrying that I might die, that people I loved might die, that we would face horrible indignities, was to think very much about what legacy will my actions, words, and choices leave for the future. And if I could think each day, am I contributing to a legacy that might be useful and value somehow, that was calming for me and helped me deal with the daily fears. I could see something I was accomplishing and the people around me, I could see their legacy. And it gave me a chance to honor each day the work that people were doing, whether it was just the basic work of getting up in the morning or whether it was something super heroic, there was still a legacy to be honored there. And that's part of what our work at the Historical Society is about.
Beautifully said. Thank you, Gerard. Brenda, this is your softball to make a pitch. Okay, unmute.
Okay. I'm unmuted. So I want to first respond to Gwen. I just applaud everything that Gerard just said, but I would add to it that, how do we decide when to compromise and accept a less than perfect solution? I really think that has to do with what's at stake, and it's going to be different based on every thing that you're talking about. I mean, if someone's life is at stake, do you compromise? If it just really depends. And you do that thoughtfully and with a group of people, and you try not to make the decision on your own. In terms of what I can do today, what you can do today, you can wash your hands. You can stay at home. That is, I think, the most difficult thing for me as an activist to do is both of those things. But fortunately, when we're watching,
Brenda, it looks like you're
launching.
up.
Oh, can you hear now? Can you hear me now?
We're good.
Terry and I are looking at launching a Bay Area COVID working group to really deal with local issues. Other things that neighbors who can't get out their house. There are many things that we can do just by paying attention and looking. Healthcare workers who have vulnerable family members at home, if they don't have a living situation where they can split a house, they need to be provided with something like a hotel room. We need to be out there getting people access to alternative living situation if they're on, as well as addressing homeless issues. We can do that through letter writing, through phone calls. There's a lot we can do without leaving our homes. How's that?
Great, that's great, Brenda, and I'm sorry about the audio difficulties there. Everyone, I want to apologize who sent in a question. If we didn't get to your question, I'm hoping that we got to all of them in some way or form. We have a recording of this again, and it's going to be posted online. We're a little bit over time. I just want to say thank you so much to our wonderful panel. This is a great discussion, very short. Unfortunately, we could really go on for hours, I'm sure, and we should, in some way, shape, or form. I think the bottom line message that I'm getting from all of this is, that, I mean, this is a very different kind of a crisis, but it is a crisis. In a lot of ways, it feels the same to me in terms of the level of urgency and passion that I feel around it. There is a different kind of a fear, as Lito was alluding to, that just in terms of the transmissibility, there's, I mean, I had a lot of fear back then just about sex, and now it's about, just being around other people, period. And all the differences and similarities that we could go on and on about. And I think it is, to Matt's point, it is constructive to compare and contrast in some sense. And yet we don't want to get into the trap and the mindset of, comparing diseases, with this disease is worse than that disease, or what have you. And I think that that's some of the discussion that is going on now. We are going to have a forum later this month as part of the Fighting Back series. It's looking at stigma. And I think that's another important topic that we only touched on a little bit here and there. But there are groups that are being stigmatized right now. As during the AIDS era, it was frequently people that were HIV positive, or gay people, or IV drug users. And now it's Asians, Asian Americans, the elderly, and people, of course, who are COVID positive or COVID affected, or in contact with somebody that's COVID affected. And so, so I think we can really get into delving into those similarities. I just want to make a pitch for everyone's personal agency, that you have power, you have a computer, you have a telephone, you have elected representatives, and you have valid questions and valid fears. And as Gerard was talking about, we can take those fears and that anger and turn it into productive work that can save lives, to prevent new infections, and to accelerate the pace of housing for people that are vulnerable, the most vulnerable in our population, to get access to therapies, access to clinical research, all issues that were relevant in the age of AIDS. But now it's frustrating in a sense that this has taken so little time to get such high level and amazing sort of attention and support. And yet, millions of people died and were and are still affected by HIV and AIDS around the world. And yet, a lot of the same tools and lessons that we learned from AIDS we can apply today, and it's all valid. So with that, I just want to thank Lee. I want to thank Eric Sneesen also, who's on the call, and he's a project director for our ACT UP Oral History project, and has been amazing in terms of moving that project along and helped to organize this forum, which was funded by Cal Humanities in California. Again, we're going to continue this on a weekly basis. We hope to circle all back. I'd love to have all the panelists back again in different forums and topics. And I'm sorry we're out of time, but if anybody wants to chime in while there's still people on, if anyone has any final thing that you feel like we need to say. I feel like Brenda's pregnant with a thought.
I saw Gerard's hand.
Yes, I'll jump in quickly and just say to all the people who are following here in the Bay Area and around the world, please find ways to support the GLBT Historical Society. Join us, subscribe to our newsletter when we reopen, volunteer, save materials to donate to us. If you are still making a living, consider making a donation. We need your support, and it is this institution and its 35 years of work that has created the platform for this amazing discussion, which I so appreciated having a chance to take part in.
Great, Gerard, thanks for doing my job for me. And Lee as well, thank you for coordinating this. And I want to thank everybody who participated, who's still on the chat here, for donating already. A lot of people did donate as part of the participating in this free forum. So we do appreciate that. We made more money on this than we would have at the museum. So hey, we can pay for our Zoom subscription. Okay.
Yay.
All right. Thank you, everyone.
Thank you so much. If you want to tune in for the next ones, like Terry mentioned, these are going to continue on Wednesday evenings at 6 p.m. PST. Our next one will be on the role of art and artists in a pandemic. And then the next week on April 15th, we're doing a co-hosted conversation with the East Bay Stonewall Democrats on self-care and community building in a pandemic. So you can join us for those, and we'll have more details about the subsequent forums very soon as we are working on curating.
And I'm gonna sit down here and try to answer some of the questions that we got by text, just so you know, if people want to check in on that later on.
Mm-hmm. And this will be, this has been recorded, so it will be posted up on our website. It'll just take a day or two for us to get the recording and get it all set up. But if you want to revisit this, or you want to send it to friends who may have missed it, you'll be able to find this and all of our other filmed programs at the museum that we had done at our website at glbthistory.org/past events.
Great. Thanks, everyone. Stay safe. Wash your hands. Okay, do I sign off now?